Well, hello. We're here again with Dr. Vern Kilborn, a retired chiropractic professional. He physician. He's been many years studying, teaching, and keeping up to date on all of the issues of the chiropractic and healthcare industry. Last show, Dr. Kilborn started telling us a little bit about the history of the chiropractic profession. And I believe he's going to continue with a little bit of a little bit more of the history today, as well as some antidote or anecdotes on some of the issues or various different things that he encountered during his practice. Good morning, Vern. How are you today?
Well, I'm very fine. It's a beautiful day here in Beaver Dam, Arizona. It's starting to get very warm, of course, but
Yes, it is.
we'll get through it.
Yep, yep, that happens every summer out here. You know that?
Yes, 120 degree plus.
Yeah.
But this old human body, the adaptability just amazes you. Uh, we came from northern Utah originally, and we were used to 40 and 50 below zero winters up there. I was an avid snowmobiler, so you get accustomed to different things. And now I tell people up north that we have acclimatized so much down here that if the temperature gets down to 60 degrees, we start treating for hypothermia and frostbite.
You know, that's true. When it's so funny. When I went back to Ohio a couple of years ago, being from the cold and everything like that, I could literally count on one hand the number of times I was actually warm that I can remember being warm. It is like everybody had their house set to a comfort level for them, which was like 77, 78 degrees. And I'm walking around with sweaters and hoodies and jackets and everything else. They kept laughing at me. I can't take it. I can't even take the air conditioner being down to like 76 degrees. I'm walking around with the sweater on. So
Yes.
I get it. Yeah, we're
All
adaptable.
those people wusses. Well, what's wrong with you? You're wuss.
Right. But you go back up north right now, or it's probably 50 degrees and people are walking around up there with shorts on.
Yeah.
So, oh,
Well, I'll get back to some of the professional things that happened. Of course, the chiropractic profession doesn't have hospitals where they can do any types of internship.
hmm.
So our program there was we had our student clinic that people from the general public could come in knowing that we were students and that we could be their temporary physicians under the direction of the faculty at the college. My particular profession or my particular interest was in x-ray. And so I was able to go into the school laboratory and do my internship during the last year I was in college.
I got a quick question for you. On the X-ray, you had mentioned before that you had to develop your own X-rays. So was that a class in itself to teach you how to do that?
Oh yes, yes, that was part of the curriculum.
Huh.
See, people don't realize it, but at that period of time, they had the program. Each state had its own licensing program, and so the one of the tests that all of the healing arts professionals had to take was a class to see what your training was in anatomy, physiology, chemistry. They called it the basic sciences. And all of the schools, dentistry, MDs, chiropractors, naturopaths, osteopaths, all had to have this degree, this test, the basic sciences. And so when we would have to take these tests at the different states, and some of them were accepted in many states, and it happened that Iowa had an agreement with Utah that Utah would accept their basic science tests. So we would set that, we'd go to these classes every so often, these testing sites, and they had them 2 and maybe 4 times a year. But we would sit right down to the side of medical professionals, dentists, chiropractors. We didn't know who it was we were sitting by. And we would have to take the same basic science tests. That was in anatomy, physiology, pathology, biochemistry, and all of the basic science subjects. And so these tests were quite challenging because you didn't know what those tests were going to be. One of the problems we had, that most of the states had their testing directed towards the medical profession. So we were not taught anything about drugs because we didn't need to have that information. Ours was mostly on the spine and the nervous system because that's our basic premise, is the functioning of the nervous system.
So your training then is pretty much like when you go into a basic medical course to become an MD. Your training up until they go into their internships is pretty much the same, isn't it?
Well, yes. The anatomy and physiology, all of the organic, inorganic chemistry, bacteriology, all of these things are basic. So we had to improvise on some of our internship by having this clinic, the student clinic. We could bring some of our friends and neighbors and people that we worked with into the clinic and treat them just like we were treating a regular patient. But all the time it would be under the direction of the faculty assigned to the college. So we went through the whole gamut of developing x-rays, and it just really blows my mind now, because at that time to take an x-ray, and most of ours were full spine x-rays, but you'd be 2 hours. You take the x-ray and then you had to go in the dark room and put the x-ray in the developer and then time it so long and check contrast, and then you put it into the fixer rather than that mixer, and it'd stay in the fixer for a certain period of time, and you could check the contrast there and see if you were getting a good contrast. Then you'd have to put it in the rinse vat and let it soak for a certain period of time. Then you had to hang it up on these hangers in the dark room all the time and let them dry. And so before most of the time, you could get a real accurate diagnosis from the x-ray, and it was 2 hours. So generally, you'd have a person come in one day, and unless it was an emergency, you'd have them come in the next day so that you could go over their X-rays with them.
Wow. I'm sure you spent quite a lot of room or quite a lot of time in your dark rooms, huh?
Oh yes. Then also in our earlier classes, sometime around the ninth quarter, ninth or 10th quarter, then we would have our own families or another student's families as patients. And so they got care anytime they needed it. And it was a so-called practice that I was fortunate because I had 4 children that I could work with, and as well as my wife, and then we had church members, and at that time we didn't have any student loans. That had never even been heard of, and so I wasn't born with a silver spoon in my hand. So at the time I was going to college, I had to hold down a full-time job also,
Oh,
because paying college tuition and caring for a family of 4, that is not an easy task.
no,
But
not
anyway,
for
I
anybody.
didn't leave college with $50,000 of debt before I started either.
Yeah.
But it's interesting, and this is one of the stories I was going to tell. One of my classmates, by the name of Walter Aiken, was from Florida, and he knew that because of my family and my association there with my workers and the church groups, that I had a little more experience than he did. So he was happy to have me treat his wife. And she had a problem with recurring migraine headaches. So lo and behold, in the last year, in our 4th year, she got pregnant and was going to have the baby. And so with the stress of pregnancy and all of the physiological changes that go on with it, and the day that she was admitted into the hospital to have the baby, all this stress, she came down with a very, very bad migraine headache. Well, of course, we didn't believe in all these painkillers and things that are so prevalent that we know can cause harm to the baby under certain circumstances. So he asked me to go into the hospital with him and treat his wife, because we knew that her problem was in the cervical spine, and I could do that in the hospital. And certainly at that period of time, the hospital certainly would not allow a chiropractor to do any treatment in the hospital. Because I think I brought up in our last discussion that because of the AMA and the restrictions they had, a medical doctor could not even socialize with a chiropractor. In so doing, they would lose their membership in the AMA. Now, if any of the folks listening question this, it's just a matter of record. They can look it up. But instead, right, I'm paraphrasing it, but it said at that time in their application for the AMA membership that they would not align themselves socially or physically with any person, group, or organization not recognized by the AMA. And they certainly did not recognize chiropractors because they had not only a nationwide, but a worldwide program to totally eliminate the chiropractic profession worldwide. They called us charlatans, they called us quacks. We were a cult that they associated with the Manson family and some of
Oh,
those.
wow.
And this remained in effect until the 1970s, when earlier, the late 60s and early 70s, a group of 5 chiropractors out of Chicago sued the AMA. And it was in litigation for 16 years. And it went all the way to the United States Supreme Court. And the United States Supreme Court ruled in favor of the chiropractors. And so that opened the door that now chiropractors can be in the same office with a medical practitioner. But that's a lot of history I didn't really want to get into, but this is something that needs to be known, because I lived through that period of time after I was in practice. My children would sometimes come home from school crying because the school nurse had said, well, your daddy isn't really a doctor, and your daddy maybe got his certificate through the mail order, and your daddy, their profession, kill people.
Oh,
How do you explain that to your children that were given this information, had that attitude by the school nurse?
right. From an authority figure, yeah, that's pretty hard. Who do you trust and believe?
So resentment, yes, I carry a little resentment. And I dealt with that somewhat in my private practice for the 17 years that I practiced before I crashed a hang glider and fractured 2 cervical vertebrae and became a quadriplegic. I don't know if we covered any of this earlier, but
We
that's
did.
why I haven't practiced now for over 40 years. But because I love this profession, and we now have the scientific proof of what happens when we give a chiropractic adjustment. And so I want to keep abreast of all of the new developments of my profession as well as healthcare in general. And so I have kept my license up all of these years, even though I have not been actively practicing. So most of the things I do now is I give some suggestions and advice with nutrition and some supplementations. I don't try to sell anything. I just try to make people aware of what's available and what I feel, in my opinion, is necessary for their good health. I give seminars here in our clubhouse periodically and have people ask questions, and we cover different body systems and how they work and how they function, and just how this body of ours has the adaptability to do many things that we don't give it credit for.
So, you had a couple of stories about some unusual people that you encountered in your profession. The one in particular was a 49-year-old woman who didn't know something.
Oh, yes. Well, let me finish the story here about
Okay.
me going into the hospital while I was still in college. Well, we went to the hospital, and so my friend Walter just walked up to the nurse's counter. So the nurse said, this was a nursery, of course, and so you would be there to see somebody. I mean, duh.
All right.
Anyway, he said, who are you here to see? And he said, I'm here to visit Wanda Aiken. She said, okay. So he walked on through. So I walked up to the counter, and the nurse said, who are you here to see? And I said, well, I'm here to see Wanda Aiken. And she said, well, only the father can visit. And she says, so which one of you is the father? And I says, we really don't know. While the nurse still had her jaw laying on the counter, blinking her eyes, but we went ahead, and so I was able to manipulate her neck, and Walt stayed on watch to make sure that none of the nurses came in and saw me in the process of manipulating the cervical spine. And so in just a matter of minutes, while the headache was gone, and we looked at the baby and everything's fine, and went on our way. But several months after this, just a few weeks before we were loading up to come back to Utah, then Wanda got questioned. He says, well, how did you get in to give me that adjustment in the hospital? And I told her the story. And she says, damn you. She says, that's why all these nurses were standing around giggling and pointing their fingers at me for the next several days I was in the hospital.
And did you ever determine which one of you was the father?
Yeah, there was no question. But anyway, that was...
That's cute. You have a really good sense of humor, and you're quick too.
You know, this lady that I was talking about, it happened that her husband had been transferred from an air base in Pennsylvania. They closed the air base down, and so he was transferred to Hill Air Force Base. So in the process of moving, he had been married previously, but his wife had passed away. So he remarried. That he married a lady that had never been married before. And so they married when they were in, well, he was in his 40s, I believe. But she was in her early 30s, probably. Because when this situation happened that I'm going to tell you about, she was 49 years old, and her husband was 55. As they came into Utah, both of them had previously been under chiropractic care, not a whole lot, but they'd had previous care in Pennsylvania. Well, they looked me up and became my patients. Well, I worked with both of them over several months. And so when women are more aware of this than a lot of men are, everybody should be aware of this, that during pregnancy, there's a whole gamut of changes take place in the body physiology. Their joints start producing more synovial fluid, and their texture of their skin changes, their hormone balance changes. with hormone balance, you never know what all these changes are. But when, as chiropractors, we do the hands-on type thing. And so you become aware of body texture, tensions and pressures, and well, even the emotional status changes to a certain degree. But over the period of years that I had been in practice, I could tell within just a matter of sometimes several weeks when a woman became pregnant. And so I certainly felt that this lady knew that she was pregnant. So I never really discussed it very much, but she was about 4 months along. And the subject came up, and so I mentioned to her, I said, have you contacted a doctor, an yes,
Obstetrician?
obstetrician? This gray matter gets a little foggy here sometimes.
Sometimes.
That have you contacted an obstetrician? And she said, well, why would I need an obstetrician? And I said, well, because at your age, you're 49 years plus, you've never had a child before. And I says, your body is not as young as when you were 20 and 30. And so there could be complications with the delivery. And she said, what are you talking about? And I said, you're not aware that you're pregnant? I can't be pregnant. She said, we've been married for 11 years. We've never tried to prevent a pregnancy, and we're not having any problems. I can't be pregnant. And I said, ma'am, you're pregnant. I don't believe you. I can't be. And she was getting a little hostile about it. And I said, well, tell you what, you go see an obstetrician. And if you are not pregnant, and I am giving you God's honor here, if you are not pregnant, I will pay for your office visit, if it's finances you're concerned about. I says, in your best interest, I would think that maybe you and your obstetrician would consider doing a C-section. Lo and behold, she went to the obstetrician, and sure enough, she was pregnant.
Never had to pay for that visit, did you?
No. But then the husband, she didn't get quite upset about it. Her husband said, I can't believe this. He said, I'm gonna, by that time he knew that they were going to have a boy. I had already told her that too. Now I won't go into those stories, but anyway, he said, here I am, and I'm going to be trying to catch football or baseball with a 15-year-old child, and I'm 75 years old. And I said, you will get through this very well. Don't worry. And it just happened that there was a movie out about that time, and it was called It's Never Too Late. It's still available. All you folks are on Netflix and want to look up that movie. But it's a movie about a pregnancy in later life, and it fit these two people to a T. So I looked around Ogden and Salt Lake, and I found that this movie was still playing in Brigham City, Utah, which is about 30 miles away from my office. So I drove up to Brigham City and bought them tickets to see that movie and gave it to them as a gift. Well, the child was naturally born, and it was taken C-section. And
It was a boy?
it was a boy, and out of respect, they named the child Daniel Vern Funk.
Aw, very nice.
So I was very honored to do that.
Aw,
Naturally, since I had not been in practice for all these years, the Funk family moved back to Pennsylvania, and I'm sure that the husband and wife have since passed away. But the last I heard, their son was living in Pennsylvania and had, of course, grown to manhood and had a family of his own. But I don't know how there's any way I could ever contact their son after all of these years. But I've often wondered how things went with the family. And
well, with the internet, I mean, you could probably just Google him right now. Find him on Facebook or some kind of social media site, I would imagine.
but I kept track of the folks for a long time, and even after I had my accident, I was going to try and go visit them at some time, but with being a quadriplegic, that was a little difficult to do, and I did not expect that I'd ever get to the point that I was going to be able to travel anyway. My expectations as a quadriplegic at that time, your life expectancy was 5 to 7 years, and there wasn't a whole lot expected of anyone that was a quadriplegic at that time.
Well, you sure beat the odds all the way around that one.
But different things happen in private practice, and treating people and their families. we were fighting this anti-chiropractic movement by the medical profession all these years, and so we had occasion sometimes, and I'll have to say the chiropractic profession is about 125 years old now.
Really?
Professionally, yes, this next year will be 125 years. And
Wow.
there's still a lot of stigma attached to the results that chiropractors have been getting and are getting presently. But the stigma is that all of these things are just coincidental, and that chiropractors aren't doing anything, and it's all psychosomatic. Well, I guess there can be psychosomatic situations in any profession, but I have to say that for 75 of those 125 years, the chiropractic profession survived on medical failures, because most of the people that we got in our offices has already been the gamut with the medical profession. They hadn't been able to do anything for them. And lo and behold, we were able to do something. But one of the first things that I encountered was a young girl. She was 3 years old and had been diagnosed as having cerebral or cerebral, and I'm making this emphasis, cerebral or cerebral, which side of the Mississippi River you're on,
Right.
palsy. She was 3 years old. She could not walk or talk. She was not toilet trained. And she had been under supposed chiropractic care for almost a year prior to my coming on the scene. I did not have the finances to start my own practice at that time. And so I moved into a practice where the husband and wife were chiropractors, but the husband was the only one that was really a chiropractor. That he passed away of a heart attack. And so I was asked to come in and kind of take over the practice. The lady was licensed, but like I said earlier, she was not a chiropractor. She had been treating this little girl for whatever period of time prior to my being there. And so when the first time I tried to work with this child, the child was screaming. She was just frightened right out of her wits, afraid of being touched by a chiropractor. The first thing I did was to throw away my white smock that was prevalent at that time. And I said, "How have you been adjusting this child?" "Well, we've been restraining her." "Well, you don't do that. I've adjusted babies hours after they were born, and you don't restrain them. You work with them." So I had a period of time there for probably close to 2 months. I would have the mother bring that child into the office. I put on a bright colored smock. They weren't called smocks, but anyway, I would wear something very colorful like the suit that I have on now. And I never wore white, and I never tried to take the child. I would just talk to the child, and I drove 30 miles to buy some special oatmeal raisin cookies at a natural bakery, and bought them specially for this child. And so when it came in, I would give her these oatmeal and raisin cookies as a treat. I got her so that she would come to my arms. So I just hold her and put her over my shoulder and rub her back and play with her neck. And so the child was aware enough that she knew what you were talking about, even though she could not verbalize anything at that time. So finally, I got to a point that I went ahead and adjusted her spine and her neck without her even being aware of it. And so then when it got to a point that I could actually lay her across my knees and work on her back that way, I'd kind of tease her and say, "Okay, now you have some popcorn in your back right here. Now you're going to hear it pop. You listen." Well, within less than a year, this child was walking and talking. She was toilet trained and was doing fine. The only thing that we could see as a residual is if we had her turn her head really quick. It took just a second for her eyes to catch up with her body movement. But the last time I saw her as a patient, she was 6 years old, was in elementary school in first grade, doing fine. And then the last time I saw her anytime was I went to her marriage ceremony when she got married at age 19. And so what the answer was when the conversation came up about a chiropractor curing cerebral palsy. Well, the chiropractor didn't cure anything. I did not cure that little girl. I did not cure her of cerebral palsy. All I did was relieved the nerve pressure on that spinal column that let her nervous system and particularly her brain develop. But what the medical profession's explanation was, well, that was a misdiagnosis. She really didn't have cerebral palsy. Well, duh, okay, you believe whatever you want. We'll believe whatever we want. But it worked. I saw it happen. So it's just very disturbing. And I have time, I think, to tell you one more interesting story. And this is the first 2 years that I was in practice. I was still had a practice in Morgan, Utah. The incident with the little girl that I was talking about with the palsy, she lived in Washington Terrace, just out of Ogden. And so the office that I was working out of was in Roy, Utah. Well, after I had had several of these instances, like with this little girl and people not being treated, I could not stay in that clinic anymore. I finally just said, no, I can't do this anymore. It's not working. You're misrepresenting our profession, and I won't be a part of it. And so I just had my office in Morgan, and I had to, because I did not have the funds to buy office equipment things, and I was holding down a full-time job as well as practicing my profession. So this family that lived there in Morgan called me up on the phone and said, "Do you think you can help our daughter? We've heard what you did for the little girl down in Roy, and said, do you think you can do anything for our daughter?" And I said, "Well, I don't know. What's the problem with your daughter?" And so she gave me the history. The little girl had been born several weeks earlier than this phone call, and the baby weighed just under 12 pounds, 11 pounds, so many ounces. And within a few days after she was born, almost immediately after she was born, she started crying a lot. They couldn't know what was happening. They tried to feed her, and she wouldn't eat, and just kept crying. And so by the time that they called me, this baby had lost the weight from just under 12 pounds down to 5 pounds. And they had her in and out of the doctor's office time after time, and they had run all kinds of tests, and the baby just kept crying and losing weight. And so the doctor then gave them an option. Your baby is dying, and we don't know what to do. We've done everything that we can. We don't know what's the matter. So you can either take her home and love her for a few days or a week or so, a couple of weeks maybe, or you can take her down to the University of Utah Hospital in Salt Lake, and they can run tests on her, which in other words said, we'll experiment on her. They said, no, we won't do that. And I said, and so they said, do you want us to bring her over and see? And I said, absolutely not. I will come to your home and I can check her out there. So I went to the home, and I could see immediately that this child was in a very serious state. And I could tell why they were so concerned, because she was ready to die. So I took her in actually the palm of my hands and checked. And the first thing I check when a newborn with a newborn baby is check the cervical spine, and particularly if it was an instrument delivery. And I don't know if this was an instrument delivery or not, but the cervical spine many times is injured during the birth process and will cause problems the rest of their lives. But anyway, I was able to examine this little child's neck, and there definitely was a problem with the first two cervical vertebrae. And so I was moving it around and seeing what kind of movement. And so I could tell it needed to be moved. And I asked the parents, I said, is it okay if I adjust this little girl? And they said, do anything, try anything. We're desperate. So anyway, I just kind of tweaked that little neck, and there was an audible pop, and immediately the little girl just relaxed and stopped crying. And so both the parents says, is she dead? And I said, no, she's not dead, she's asleep. I said, let her sleep. This is what one of the things she needed all these weeks. She needed some rest. She's been in pain, probably a headache. It's unimaginable, but this little girl was just crying almost incessantly, day and night. And so one of the problems is with crying like that, she couldn't eat. If you don't eat, any of us are going to lose weight. If you want to wait that long, then anyway. So I worked with the child, and they said, well, I haven't been nursing her because it's been too long a time. So what do you recommend? We need to get her some formula. And I says, this may sound strange, but you go to one of the dairy farmers around here that are on A-grade milk. You get whole raw milk out of that dairy, and you warm the milk up and sweeten it with honey and start feeding this baby whole raw milk with honey, which they did. And within just days, she started gaining weight. I sometimes made house calls 3 times a day and checked on this little gal, and anything that was out of line at all, we lined that up. But within 2 months' time, she was back up over her birth weight. And then, believe it or not, Terry, the county nurse informed me that she was going to file a malpractice suit against me because I was a threat to her life, because I had told their family to feed that child whole raw cow's milk and honey, and the honey was going to kill that baby because the honeybees flying through the air picked up bacteria and put it in with the honey, and it could damage that baby.
Honey's one of
Honest
the
to
best
God, Terry,
antibacterials around. Wow.
these are the things that we dealt with. And
Yes.
I'll, is our time pretty much up here? Have I
No,
got?
we got a good 5 minutes left.
Okay, well that gives me time. to tell you the crasher of all of these things. And that is because of this AMA thing. At that period of time, if a medical doctor was not a member in good standing in the AMA, then they just as well have gone to McDonald's. It wasn't McDonald's then. It came out about the time I graduated from school, but they just well go somewhere and flip hamburgers. Because if they did not belong to the AMA, they were denied hospital privileges and they were denied access to pharmaceutical companies. Take those things away from a medical doctor, and he's not going to make it anywhere.
No.
But I had 2 medical doctors' wives from Salt Lake City. I reopened my own office in Roy at a later date, and that was where I was practicing when I crashed the hang glider. But when I had my office open in Roy, 2 medical doctors' wives would come up to my office periodically in Roy, but they had to come after hours when my office was closed because they could not be seen in my presence, and let alone receive treatments from a chiropractor. And the one medical doctor told me, he said, Vern, I have access to all of the medications anywhere in this world. And he said, the only thing I can do for my wife's migraine headaches is to give her a shot and put her out for 24 hours.
And what good does that do? You know, that's so much like the medical profession today. They either want to pump you with drugs or surgery.
Yeah.
You know, they don't give you any other alternatives, you know. It's just mask it or take it out and replace it.
Well, he said since she's been coming here, she has not had a migraine headache since. And I had told her the area in her neck that was causing the problem. And I said, you keep touching this periodically. If it starts to get tender, then call me. You can either come here, I'll come to Salt Lake and make a house call, whatever, but that needs to have attention. And so as long as she did that, did not have any migraine headaches again, and I lost contact, of course, when I became paralyzed and was not able to even blow a fly off of my own nose. And so I couldn't very well give any chiropractic adjustments, but they could not be seen in my presence or in my office.
So what's the state of the AMA now? I mean, it's not nearly as prevalent in the medical profession as it used to be, or as big a deal, right?
Well, this is what I mentioned earlier, that 5 chiropractors out of Chicago took the AMA to court and sued them. And it was in litigation for 16 years, and the United States Supreme Court ruled in favor of the chiropractors, and they charged them with several counts. One of them was racketeering and violation of the Sherman Antitrust Act. If anyone questions this, it's all a matter of court record. I have a video right here in my office, in my room right now, that I can play or transcripts from that court proceedings.
And I understand all that. I'm just saying now, like, you couldn't, unless you were a member of the AMA years ago, nurses, medical assistants, doctors, you couldn't practice in a hospital. Now that has switched, hasn't it? I mean, the AMA is not something that you have to become a member of anymore.
No, my understanding is less than half of the medical practitioners now belong to the AMA. The AMA, I hold no resentment at all against the individual practitioners. God only knows that I've had to rely on medical profession several times in my life, and I don't hold any resentment at all against those professions, but I do against the AMA as a political organization. And that's what they have become. They're a union. They were, and they're really a union. They're not really an organization that has the best interest of the AMA.
Yeah, it used to be a real big deal to have those initials, member of the AMA, after, anything. Even when I was a medical assistant, that was the thing, to have the AMA endorsement. But yeah, if it has become very politicized, and the AMA is all about the pharmaceutical industry, and I think that those organizations such as that really kind of mess up a profession, because you've got a bunch of people who are in the AMA who aren't necessarily even medical professionals. They just board members or decision makers on something that they don't know about.
Well, it just happened that the neurosurgeon that worked with me when I crashed the hang glider, he had the reputation. He was probably one of the greatest neurosurgeons this side of the Mississippi River. And he and I had, under the table, worked together on several times on referring patients back and forth. And so when he took over my care in the Holy Cross Hospital in Salt Lake City, he didn't care about the AMA because his reputation would have carried him through with anything. But he worked with me and allowed me to make the decisions on how I was treated and how I was cared for. In fact, I talked to him on the radio telephone when they were hauling me in from the point of the mountain in the ambulance. And I talked to Dr. Powell on the radio telephone because we didn't have cell phones or anything like that at that time. And so I asked him if he could find, that he could take care of my spinal injuries. And I had my right arm that was shattered in about 6 different pieces. And so I asked him if he had a colleague an orthopedist that would handle the arm. And he said, yes, we'll be here. And so the ambulance took me right to the Holy Cross Hospital, and Dr. Powell and Dr. Carson came out and helped them get me out of the ambulance and immediately started care.
How long did it take from the time of your accident until you were able to actually walk again? How many years of recovery was that?
Well, it wasn't really years. It was about 4 months before I got any movement, and then that just started in one toe. So from there, I just worked with it. There wasn't any physical therapy or anything done on me for over 8 weeks because the theory was if you're a quadriplegic, you'll either come out of it or you won't, and you've got 5 to 7 years to live. And so there really wasn't a whole lot done until I started to get movement in one toe. And then I thought, well, we better start on these other things. And so it was a slow, gradual process. This thing that, Rip Van Winkle wakes up after 20 years of being asleep and he walks down the street. No, that didn't happen.
Your muscles atrophy.
Everything shrinks up. I lost in 3 months. I lost over 90 pounds.
Wow.
Body weight. And when I give some of my speeches at times, I say, yeah, I lost 90 pounds in 3 months. Weight Watchers, eat your heart out. No, don't go break your neck just to lose 90 pounds. It isn't worth it. But it was months and years of working, because I forced myself. When they had me start doing physical therapy, they'd say, well, do 10 of these. Well, I'd do 20 of them if I could. And then when I got back to my room, I'd do 20 more or 40 more. Some nights I laid awake all night exercising, forcing it, because that's the thing I determined above anything else. If you don't do it for yourself, it isn't going to get done.
Right.
Because people can't do these things for you. And it's too damned easy to get into the habit of having people wait on you and have them meet all of your needs. You get pretty used to it. Well, that's closing the ends of the rut, which makes a grave site. If you don't do it, it's not going to get. And a lot of people make invalids of themselves that don't need to. You do what you can do right up to the last ounce of strength that you've got. And it doesn't stop there. There isn't a day goes by that I don't stretch my fingers and keep those things from stiffening up. People think this is arthritis. It's spinal cord damage. And they stay flexible, and I can work them. When I was flying an airplane, those curved fingers fit nicely around the steering wheel. It fits nicely around the steering wheel of my car, my four-wheeler, the handlebars. I went back riding motorcycles again.
Oh, wow.
And with those curved fingers, and I had a medical doctor that was going to straighten those fingers out for me. And I says, how are you going to do that? Well, we'll just clip that profundus tendon. And I says, the hell you will, because you start nipping those tendons. Sure, my fingers will look very pretty,
but you won't grow.
I need them to be functional. And the mortician can make me look damn pretty after I'm dead, but it's not going to happen before that.
There you go.
I'm sad. It doesn't look pretty now, but they're functional, and I do about anything that I want to do that's sensible. So it's just one day after the next.
Well, there you go. And I'm sure that all of the knowledge and everything that you've gained, you definitely keep abreast of all of the knowledge about your health. Excuse me, not just other people's, but yours, as you know, in particular, to see if there's anything more you can do to stretch those muscles. I'm sure you're always looking for different things to see if it works, you know, and trying it.
Yeah, I just had my 87th birthday, and I do not take one single thing, prescription for anything. I don't have high blood pressure. I am not a diabetic. I'm not anything. I'm a quadriplegic recovering, and I'm satisfied with that. I do take a lot of supplements.
Uh-huh.
I won't deny that a bit. And is it the supplements that's keeping me from having all these other medications? I don't know, but I'm damn sure not going to stop taking it to find out.
Yeah, exactly. If it's not broke, don't fix it.
No,
It seems to be working well for you. Well, thank you so much, Vern. We're going to say goodbye for today, but we will definitely be having you back very soon. So don't go anywhere. Thank you, everybody. Dr. Vern, stay tuned for our next great meeting with him, which will be soon. The prior videos are out on YouTube. The current video will be out on YouTube later today, and we'll put them on some Facebook pages as well. And then we'll find out when Dr. Vern will be able to come back with us. And hopefully next time I won't be in Facebook jail so we could go live. So we're going to say goodbye today. Peace, love, and happiness to you all. Thank you.
Take care.